Hello and welcome to another episode of Fulbrighters for Disability Inclusion. I'm your host, Samar Naqvi, and today we have with us Dr. Nukhba Zia. So, Nukhba Zia is a Fulbright alumna with a master's and a PhD in health systems from Johns Hopkins School of Public Health. She is also a medical doctor and works as a health systems researcher and a core faculty member at the Johns Hopkins International Injury Research Unit. She has over 10 years of working experience in several countries, and her research focuses on health systems at the intersection of injuries, disability, and rehabilitation. Nukhba is also involved in teaching and mentoring with a keen interest in translating research findings to actionable recommendations. Nukhba, thank you for joining us today and welcome.
Thank you. Thank you, Samar. Thank you for having me.
So for starters, we would want to know a little bit more about your research, all that your interests are, and specifically related to disability data collection and measurement, and how that can inform policy making and potentially decision making at the highest of levels.
Yeah. Samar, thank you so much for this question. I think I'll start off with the thinking around disability first, and then talk about the work that I've been doing. So we know that for the past 2 decades, the conceptualization around disability has evolved quite a bit. Previously, it was thought only of something that was related to medical conditions. So, somebody who has a fracture, or somebody who has a neurological problem because of diabetes, for example, so they're not able to walk properly, or somebody who develops polio and develops a limp. So, it was really considered a linear thing that a person develops a medical condition and that leads to a certain type of disability. But over the years, the conceptualization has evolved because disability is not just the medical condition. It is also how a person is able to function in their environment and how they're able to participate in the different activities, while also acknowledging their personal factors, their environmental factors. So I'll give you a little example. So think of a young man who is in a road traffic crash and they fracture their lower limb. So they have to be in a cast for about 6 to 8 weeks, for example. And obviously with the cast, it doesn't mean that they cannot move. Like, there is rehabilitation, and there are other, they get a crutch or they get a wheelchair. At least, there are things that can be done to improve their functionality, so they don't feel that they're not able to mobilize themselves and they're not able to move around. But the same person, if they are in a part of the world where they're not able to even move around in their house. So for example, if there are stairs in the house and there are no ramps, or if they're able to go to school, but in the school they need special provision in the bus, or to reach their classroom, they would need ramps. So those kind of things are just going to be very disabling for them, just because the environment is not supportive of it. Whereas, in many developed countries, we see that there are school buses that have special ramps for individuals who are in wheelchairs. The buildings are constructed in a way that they provide access to classes, and there are provisions for these individuals. So while this person had a disability for a very short time, they will come out of the cast and they will be able to go back to their functioning. But just those 6 to 8 periods can be very disabling for them, depending on where they are and what kind of environment they're in. So I think that conceptualization and that realization that disability is not just the medical condition, but it is also how the person is able to move around in their environment, and how conducive that environment is to their needs. So there's that aspect in terms of what disability is. The other aspect around disability, which I think is very crucial, is data. And very recently, we in health, we know that there are sustainable development goals related to many different aspects of healthcare, and they have specifically talked about disability-specific goals, and I think that's really important, because that really creates a global momentum towards understanding of disability. And one of the goals, I think it's Sustainable Development Goal 17, which talks about having data systems that provide reliable and timely data. So to address that, you basically then need to start thinking about that. How do you ask about disability? Because the word disability on its own has a very negative connotation, right? It creates a lot of stigma, there's marginalization, and historically that is what we have seen, that the minute you call somebody disabled, it just like, you start perceiving somebody in a very different light.
Right.
So I think from that perspective, asking the right set of questions, that how do you assess disability becomes very crucial, and to do it at the global level. And we can talk later about, the different efforts that are being done towards addressing this gap, that how do you get the data? How do you get to know where these people are, who these individuals are, what's the male-female distribution, which age groups are most affected, what type of diseases are leading to these disability. And I think that's really, really important, not only for those who are providing health services or rehabilitation services, but also for other sectors. Education sector needs to know who is being affected and how they can provide those provisions that can help integrate them. So for example, anyone who's blind, if we don't know those numbers, we wouldn't know, what resources are needed, and what kind of tools need to be created so that these kids are able to come to school. Similarly, workplace and development sector. So having these basic data, just like basic set of information, is very crucial. So I think with all those things, it becomes really, and the momentum towards disability and the work around disability is moving really fast. I mean, I think it's really not just a data factor, but just a realization that disability has to be included into different sectors and the different way people perceive about it, and start thinking about it in their work and how they can integrate it. So with all of that, I basically started my work on disability because my initial exposure to public health was through injury research. So I started work on road traffic injuries and childhood injuries. And one of the areas in injuries is burn injuries. So we see that individuals who suffer from burns, whether they're at home or at a workplace, it takes very long for them to recover from their injuries. It's quite a bit, and especially if they have been hospitalized. So that was like my very first set of piece of work that I did to assess the change in their functioning.
Yeah.
And you'll notice that I use word functioning quite a bit instead of disability, because it's basically, how a person is able to navigate in their environment. It's not just like, their condition, but how they're functioning and how to optimize that functioning.
Right.
That's the crucial bit. So that was my very first area of work. Obviously, over a period of time, that has evolved. I now work quite a bit with children with disability. I've developed tools using standardized UNICEF and Washington Group questionnaires that could be implemented in community settings. I've trained community level data collectors to collect this data from children, and not from children who already have disability, but in general, applying these tools to all children in the community as a way to early identify children who might be having visual disability, or who might be developing hearing problem or learning problems. And that to me is very important, especially in children, timely diagnosis, timely referral, and how you do that is important. And then, again, with all that piece of work, I've also now engaged in working with children who are in residential care. So how these disability tools can be made part of their case management toolkits, so that while their cases are being considered in the residential care, the children with disability, because they're marginalized, they're in residential care, so they're at a very vulnerable stage. So how we can equip the caregivers and the case managers in those facilities to identify children and make referrals. And all these efforts are kind of like aligned with a lot of work that UNICEF is doing. So these are very minor contributions, but hopefully, adding towards something that is around disability inclusion. Another piece of work that I'm involved in is developing toolkit for community health workers, and more so integrating the concept of nutritional assessments with disability. So, again, there's a lot of vulnerability around children who have nutritional deficiencies. And if they're disabled, then there's a very high chance that, the care is not appropriate, because these two issues are not considered together. So that's another area of work that I'm involved in. And then other than children, I also am assessing reproductive health services and their access to pregnant women with disabilities. And how that looks like, whether the facilities that we have are equipped to provide those services for pregnant women with disabilities. So for example, a simple thing, when pregnant woman comes to the hospital for antenatal care, and she has to get onto the examination bed to be examined. The height of the beds is not appropriate for these women. They're quite high for them. So, for them to just get onto that bed is such a hassle. And if there's no support, if there's no nursing staff, or if they don't have a caregiver, they won't be able to get onto that bed, which basically means they're not going to be able to be examined by the doctors. So so basically this is my small pockets of work that I'm doing around disability, all stemming basically towards trying to contribute towards the data around vulnerable groups. I think within disability, there are vulnerable groups. Children are vulnerable, elderly are vulnerable, women are vulnerable. I think that kind of is the common theme that you can probably picture in the work that I do with disability.
Wow, that's wonderful, Nukhba. I mean, you've given me so many areas to kind of frame my next question around, and while you've spoken about the importance of data as well, it's pretty significant here in Pakistan as well, because if you really consider the census and how much of a population comes across of people with disabilities, provisions, resources are allocated based off of that. And I'm glad you mentioned the Washington group of questions, and you were talking a little bit about how do you assess. The right questions would be, how do you assess disability? How do you collect that data? What is the best way? What are some of the best methodologies? I'm so happy that you're working on these little tiny bits and training community workers, etc. I mean, your work is mostly around, as I understand, acquired disability. So potentially children who have some form of injury, or you were speaking about burns, and how they then experience a limitation in their functionality. And I wonder what that is like, just that experience of being there and knowing a certain level of functionality and then kind of moving back from there. How is that for the children emotionally? How is that for the parents, the caregivers who are around emotionally? If you could sort of talk a little bit about that too.
That's a very important question, Summer. And more recently, I have also started working with children who have cerebral palsy. And there's a huge difference in the way how things are approached. And I think that just takes us back to how disability is conceptualized, right? Yeah. So the acquired disability obviously is very devastating. And whether even if it's for a short term, even if it's temporary, it does have effect. It not only affects the child, or even if it's an adult, if they're fractured, if they're the only breadwinner of their family, the whole family is reliant on them. And if they are out of job for 6 to 8 weeks and they cannot work at all, not everyone has the privilege of being at home and working from home. Think about a physical laborer who is working and now they have a fractured limb and they cannot work. They work on daily wages. So that has really detrimental effects. And I think the key thing that I've noticed with all this is that the support system the individual with disability has during that time plays a very, very crucial role. And I'm talking about this irrespective of which social class they come from or how many, however amount of resources they have. If the group, the group of caregivers around them is able to understand their condition, is able to help them navigate that, it makes a huge difference.
Yeah.
And it's not just for children, for example, it shouldn't just be the mother, it should be the father, the grandparents, for example, or the household. If they go to school, their teachers can play such an important role. If they are, if this person is working, then their employers can play a significant role in this. And this is just like, the emotional part of it, how this community can come together. And it becomes very important in many places where we don't have good social and mental health services to help the person who has developed disability, plus their caregivers, that, what to expect, how do you prepare for it, and how you can move along with it, because it is there. We have to deal with it, but how do you deal with it is something that's kind of like a trial and error for many people.
Yeah.
The other thing, other than the emotional aspect, I think, is the financial aspect. So in many countries around the globe, there are insurance mechanisms. So, one way or the other, with disability insurance, they're covered. And that kind of like provides some kind of a support, and, doesn't has a potential to, give them security. But in other places where such provisions are not available, it really can be catastrophic for the individual and their families. And that can take many different shapes and forms. People really get into severe depression, and people try and commit suicide because they are not able to find a purpose for themselves. And for children, for children, the issue is that they can't even express themselves, right? So they don't know what they're going through, and they're not able to express, and that frustrates their parents. And when the parents are frustrated, they're not able to navigate the situation. So I think it's just like a huge package of things that need to be considered. And I think that's where the health sector can play a very important role, especially because that's the first point of contact. That's where the problem is starting, to help lay out certain recommendations that are geared specifically towards the caregivers, that are geared towards the second circle, which could be the employer or the teacher or the educators of that individual. And then, the larger society, what can be done. And I think the problem with all this is that we tend to think about everything in one go.
Yeah.
The important thing is that we break it down, what is it something that can be done in next week or 2 weeks, for example. Taking the same example that we were talking about, somebody who's in a plaster for 6 to 8 weeks, how do we break that down for them? And all of this is important because, for example, I know that in Pakistan, they'll be doing census, which will include questions, more detailed questions on disability. If the census folks are going to these houses and asking them about disability on the day when they had the disability, they're going to get responses which would be like, oh, everything's kind of like come to a standstill for them. Versus, if they are going to a household where a person has had disability for a little while and they've adapted to it, then they're much more, into it, and they know how they need to handle the situation. The response is going to be entirely different. I think that is something, so other than that, I think we can talk about it later, that the timing of asking these questions is, the work I did with Burns disability was, looking at this factor that we basically were asking them about their baseline level of functioning right about when they were being discharged. And it was very difficult for them to think about that time because they've been through a lot because of their voluntary, So it's very crucial the way the questions are asked, when the questions are asked, who you're asking, who the respondents are.
Absolutely. And like you said, there's so many variables. It's not as straight as people or simplified as people often imagine it to be. And data, the one thing that often goes against individuals with disabilities is that data goes against them. The numbers that are counted are much less, and like you said, there's so many things that's dependent on. The timing, of course, who the respondent is, of course, and then there's so many other bits as well. The tone of asking, the words, the terminology that is used when asking certain types of questions that are sensitive in nature. And speaking of, what is your understanding of all the literature around words and phrases around disability, and what terminology should be used, and how much of a role does terminology, words play into the larger scheme of things around the disability landscape?
I think communication and the right set of terminology here becomes really important. If we look at the studies, and there have been reviews which basically looked at how questions are asked around disability and how those questions have evolved. So if you look at some of the earlier questions around asking disability, there used to be one question geared towards the head of the household, that do you have any individual in the house with disability?
Yeah.
So that basically is going in with the assumption that the respondent knows everything about disability and that there is a diagnosis in place, right? And I think that those kind of questions then prompted, and they were asking this question for children as well, And the important thing with children we need to keep in mind is that in different contexts, the growth trajectory of a child varies. And if a 2-year-old is not able to do certain things, that doesn't mean that they're disabled, for example. Or they have the idea, and that's why deconceptualization on early identification for children is important, because that's the stage where you can intervene and really help them, instead of giving them a label and a diagnosis and saying that, okay, now you're done, this is what life is going to be like for you. So I think those kind of issues around how the questions were being asked and whom they were asked of has really helped in the evolution of the questions. And I refer to Washington Group because there has been significant amount of work around the framing of the questions that they have done. I'm not advertising them, but they by far, they have even in conversations with them, they have limitations in those questions, and they do identify those limitations. But the important thing is that the way they have framed those questions and how many different versions of the questions they have come up with. WHO has also done work around disability assessment tools. So between these two entities, if we look at those questions, none of those questions say whether a person has a certain type of disability.
Yeah.
They ask questions in a way that basically ask whether a person is able to do certain activities, is able to perform certain activities. And the range of those activities varies, it varies from certain motor functions, ability to see, ability to hear, ability to use upper and lower limbs, to more abstract concepts like, learnings and making friends and concentration and the feeling of anxiety and depression. Being able to connect with people within their own circle, being able to connect with strangers. And I think that gives you a very huge spectrum to think about and to screen people on. I mean, these questionnaires by no means are diagnostic. Right. They're there to be taken up in national household level surveys or in census to identify individuals who need further care. So if these questions identify a child who has visual disability, the next line of action is to refer them to an ophthalmologist or to some kind of a healthcare. If they are identifying that kids are having some kind of anxiety and depression, then, make a referral, send them there. And I think with that, the point that you made around underestimation, you're not able to pick out these people. I think this framing of the questions where you're not labeling individuals is very, very helpful. We still have to see how that data is coming along, because it's been in the last 4 or 5 years. I think there's a lot more push towards where the countries are trying to take up these questionnaires and integrating them into different surveys. And that data is forthcoming, but it will show that the inability to perform those tasks or the extent of limitation that individuals have will then help not only the policymakers, but also those who are working in these different sectors, right, to use this data and make more informed decisions. So yeah, I think that momentum is there. We yet have to see that how this change in the framing of questions is going to be effective.
Absolutely. That's wonderful. And you described it so perfectly as well, because it is super important to see it as a spectrum, as a range, as opposed to looking at disability in a very linear fashion. So the next question might be around a little bit more around some of the things that you've encountered as you've been researching so far. So anything of peculiar interest or anything that surprised you? And the second part of this question would also sort of be around what are some of the basics that you've actually learned while interacting, engaging with different persons with disabilities that perhaps all our audiences watching right now might need to know to educate themselves?
Yeah. I think the first one, in terms of something that was surprising for me, when I for my thesis work for my PhD, I used the child disability functioning module that is developed by UNICEF in Washington Group, and I implemented that in Uganda. It was a site where we had really good long-standing relationships, and we were able to integrate the questionnaire into their data system and the way they collect the data. They shared that a few years before I had started work there was a study that was done, which was basically distributing wheelchairs to individuals with disability in the community. And after the distribution had happened, there were people from the community who came to the office of our collaborators and demanded that they also need wheelchair. And the office was like, why do you need wheelchairs? Like, we only give wheelchairs to individuals that we knew had disability, and they needed wheelchairs so that they're able to be mobilized. They mentioned that we have a child who is not able to walk and we need the wheelchair. Now, this site that I'm talking about has data on every single individual who lives in a certain parameter area. And they're like, we don't have any information on this child that you're referring to. What are you saying? Are you going to take the wheelchair and sell it off? Like, that is what the officers at our collaborator office thought. They're like, no, we have a child. So the office folks went to the house and they verified that, yes, there's a child, but that child was never part of their data system because the family wanted to protect the child because of their disability. For me, that was kind of like eye-opening that even with the most meticulous data systems available, and with such a good mechanism where they were tracking every single individual in that community, in that area, they still missed out on children who had a need. So when you don't know, when they're not being counted, how can you help? And for me, that just that just remains stuck into my mind, because as we are moving towards collecting this data and trying to find ways to integrate disability data into census or national level household surveys, there's still that factor, that the stigma around disability and the fear by the caregivers and the family members of this individual being further isolated and marginalized and being mocked or ridiculed is so important that you need to understand these social factors that what play into those decisions, and why don't we get to know about these individuals in the first place. So, so that to me is shock. I mean, I don't think I should say it's like extremely shocking, but like, that's a lesson learned for me, that, you just can't assume that because you're collecting data and you have all these amazing tools, that it would automatically extend into getting information that you need. So being skeptical, I think, always helps, because that way you ask questions that, okay, what does this mean? How does it translate? What we might be missing? That becomes important. Can you repeat your second question? Sorry.
Yeah, I mean, like, and it kind of translates like very appropriately to the second question as well, because this might actually be basic. The second part was around what are some of the basics that we kind of need to know, and you said like being skeptical perhaps helps, because then you're actually looking for what you're missing, as opposed to what you found. And that's important too. That might just be basic. But what are some of the basics that we all need to be educated on, based on your experiences and interaction, engaging with different children with disabilities as well?
So I think engagement with the individual with disabilities and the organizations that are working with individuals with disabilities, community of members where you're working, And those engagements are important because I think in this field, I think in any field, one needs to be participatory, one needs to be engaging with the stakeholders. The important thing is to listen to them. One of the things that I come from a very quantitative background, and we talk about, credibility, and we talk about generalization of results, because obviously you can't collect data on every single person in the world. So you have certain methodologies, and that's important. But I think with disability, there's an added layer of complication or complexity. I shouldn't say complication, complexity, which is that you need to understand the lived experiences of these individuals. You need to understand the lived experiences of their caregivers. And then going also beyond, like, talking to teachers, if the teachers are not equipped to teach children with disability, how can we place an onus on the teacher that, oh, they don't know how to teach? They don't have the resources, they don't have the training. So I think it just like needs to be thought through that it's not just like one entity, it's not just the person with disability. There's many other layers that need to be that we need interactions with, that we need to learn from, what their limitations are, and how we can address them. So I think given the momentum around disability and the way the questionnaires are being rolled out and the questions are being asked, it's very important that simultaneous efforts are made instead of like, saying, okay, let's just figure out the health aspect of it. Then we'll come to education. Then we'll come to, development sector. No, I think all of those efforts are happening. I mean, it's not that they're not happening. There's a lot of work that's happening in Pakistan. There's a lot of work happening in the region and globally. But those efforts need to now talk to each other.
Absolutely.
I think that's important, like listening to all the stakeholders who are involved in this area of work, whether academic, non-academic, entities like WHO, but then also entities like grassroots civil society organizations, organizations that work with individuals with disability. I think that's very, very crucial.
100%. Very, very well put as well, because and your work is around intersectionality. So it's sort of like how everything kind of comes together, as opposed to looking at each of these areas, each of these sectors, each of these interventions in isolation, because obviously that wouldn't yield the results that the impact that we kind of wish for or hope for. So while Nukhba, I personally, and I'm sure everybody watching and listening have learned a lot during this podcast, I'd also like for you to share, as we conclude, kind of like some pearls of wisdom, some closing remarks, some thoughts around research around disability, but also how we as a whole can come together and create a more inclusive society for marginalized, disenfranchised, vulnerable groups as well.
Thanks, Summer, for that. I think the key thing for me is engagement with the individuals and listening to them. And whatever interventions we want to develop, we should involve them and see whether they're going to work or not. The things that can be done in Uganda cannot automatically be assumed to be working in Pakistan. So we have to contextualize them from Pakistan's perspective. And that can only happen if these different groups are constantly talking to each other. Knowledge exchange between their experiences is very important. And usually everyone is busy in their own work. Everyone has their own vision and mission. But I think there are ways in which communities can be established, WhatsApp groups or Facebook or Slack channels, where, all the learnings can be brought to the group members. And, when there's an opportunity where they can all come together and develop an intervention or propose something to a funding opportunity or a development sector opportunity. I think those relationships have to be developed before actions can be taken, because the relationship building helps you to learn what each entity is doing. It helps you to understand where they're coming from. And then it also helps you develop a common language. that can then help and, create a unified response. And I think that becomes lacking. So we shouldn't be reactionary towards the work that needs to be done. I think it should be thought through, because the reaction part is happening. There's no dearth of that. But what's important is that how do you sustain all these efforts? And those sustainability of the efforts can only be done if you are engaging, not with the goal that, okay, I have to submit a grant with them, or I have to do a certain workshop with them. It has to be a relationship building effort. It has to be geared towards understanding where each entity is coming from, the work that they have been doing, and how the work of all these different entities can be brought together. And to me, it's kind of like a puzzle, right? So you want to create an environment, you want to create a society that's disability inclusive, and there are all different pieces of puzzle which are all laid around. And in order to put it all together, you need to have all the pieces, right? So if you're missing something, if you're missing those pieces of puzzle, no matter what you do, you're not going to be able to finish the puzzle. So I think for me, that's the way I think about it, because it's so complex.
Right.
And those engagements are important at this stage, I think.
Right. That's wonderful. Thank you, Nukhba. This has been very informative, very educational, and such a pleasure to have you.
Thank you. Thank you, Summer. Thank you for having me, and thank you for the opportunity through the podcast and also through the Fulbright program.
Thank you. You take care.
Thank you.